next thing coming up is another junior doctors' strike. That's happening later this month. They've announced 5 days of industrial action. That's designed to bring hospitals to a standstill. Now, the British Medical Association claims it was forced to the walkout after government failed to meet its deadline to put an improved pay offer on the table. But the Health Secretary insists that the new strikes are proof that union bosses are just not ready to be reasonable. Victoria Atkins argued junior doctors have already received a pay increase of up to 10.3%, and she says the government was prepared actually to go further, but union bosses just refused to put the proposed deal to the members. So this is something like the 10th walkout since March 2023, so 10 walkouts in less than a year, and will mean junior doctors have skipped some 39 days of work in the past 12 months. That's almost 6 weeks of not turning up to the job. And more than 1 million NHS appointments have been cancelled already, and it believed that another 97,000 could now be rescheduled. I mean, look, this is just dreadful. Each time an operation is cancelled or rescheduled, it leads to a real suffering amongst people. And the irony is that their condition gets worse and then they're harder to treat, and the impact on the NHS is even heavier. And in some cases, sadly, people die whilst waiting for treatment. So I'm kind of divided on this, because the reality is that we do need to retain doctors, and a huge percentage of our doctors have got to the point where, for whatever reason, a combination of reasons, a job doesn't stack up to them anymore. And it isn't just about the job, it's the whole situation in this country. It's the conditions in which they're working, it's the amount of tax they pay, and we can't deny the fact that a lot of them think that it's going to be more attractive to work in Australia, New Zealand, and the Middle East. So we are in a global competition for healthcare workers. So we've got to pay them if we want to retain them. But the other thing that I think is really interesting that's happening, if you zoom out a bit, is I think that the cult of the NHS is beginning to disintegrate. It has taken a very long time, but now I sense a real shift that almost everybody can now see that the NHS, whilst we can all love the principle of it, and we all want an NHS that provides everybody consistently with the standard of treatment that we're all deserved to expect, I think that there is a growing sinking feeling amongst this population that the NHS isn't actually fit for purpose. And it's a horrible realisation, but I think people are just beginning to face up to it.
I completely agree with you, Isabel, that working in some political reporting for 30 years, it was always my biggest source of frustration that I would talk to experts in healthcare, either, some politicians, leader of the Patients Association, leader of the NHS, whatever it might be, behind closed doors, and they would pretty much all say the same thing. And I'm going back 20, 25 years, they would all say, it's a mess, it needs to be ripped up, we need absolutely huge reform, blah, blah, blah. Then they'd go in front of the TV cameras or in front of,
say how amazing it is,
and say the opposite of what they had just said, because it was all about either, for the Patients Association or those types of organisations, wanting, not being able to badmouth their own, organisations. And for the politicians, it was all about votes and point scoring and saying, we can do it better than the others. And I think finally that worm is turning, and finally we're getting a little bit of honesty. And I think just on the strikes, it's clear to me that the strikers, the junior doctors, are waiting for a Labour government because they think the Labour government is going to be more of a pushover than a Conservative government. And I don't think it will be. I think the Labour government actually might be stronger on them, because it can be, because people think, for good or for bad, that the Labour Party is more pro-NHS. And actually, from reading what Wes Streeting's been saying, like you were saying, Isabel, he's saying things that politicians wouldn't have said years ago.
But I think that Labour will want this to go away pretty quickly.
So I think they will, but I think both the junior doctors, BMA, and actually the current government are digging their heels in because neither of them want to deal with the other side. I think absolutely this will be a real point in people wanting a general election quicker, because they'll be like, the junior doctors and the BMA don't want to deal with this government. Let's get a new government in so we can get this sorted. But I also think that when it comes to the NHS, two things can be true. You can love the principle of the NHS, you know, healthcare free at the point of contact, but also know that it needs to be done better. That after 75, 76 years, it isn't working anymore.
But
and actually,
that,
that's
but
okay.
that free at the point of delivery, I think that's going to have to change, and that's going to be very unpalatable for some people.
And only a Labour government can probably do that.
Agreed.
Actually.
Yeah.
Yeah, absolutely.
I think it's just a joke. I mean, the NHS, as you say, is not fit for purpose. These doctors, the nurses settled for 5%, the consultants settled for 12%. These junior doctors will not budge from 35%. That's cloud cuckoo land. They're waiting for the next Labour government. Meanwhile, the NHS is just a joke, and Labour will do nothing about it because politicians are terrified.
Well, they might charge us a bit more tax.
Yeah, that's right, yeah.
Probably what they'll do. On which note,
Yes.
Rishi Sunak, did anyone notice he snuck out his tax return?
He did.
In a classic Friday, you know, let's try to do this while no one's looking.
While all the journalists are in the pub.
I mean, in fairness, he doesn't have to
Why aren't
publish
we?
his. In fairness, he doesn't have to publish his tax return. So, how much do we think he made in the last year? 2.2 million, which is pretty good for a politician, given that as Prime Minister he's paid about 140 grand.
Well, given that he hasn't worked to make that money because he's been too busy being Prime Minister, so he's made that
so
money.
this is passive income.
Yeah,
so 1.8 million in capital gains from a single US-based investment fund, and another nearly 300 grand from interest and dividends.
And how much did he pay in tax?
How much is he
About
paying?
500,000.
The
How
capital
does the
gains.
Prime Minister get to pay 25% tax?
It's actually
Why is he
under
paying 20?
25%.
I'm paying 45. What's going on?
I think
He's
I
got
think
a
we
better
pay more than
accountant
that.
than
Probably.
What's going on?
Yes, he's
Not
got a
very accountant.
gold-plated accountant, Kevin.
Yeah.
They haven't issued that in the statement, who it might be. Let
No,
me
if you're
advertise
watching,
it.
Rishi, why don't you pay the same amount of tax as the rest of us?
Yeah.
Yeah, well,
Outrageous.
And a non-dom wife.